And next, there's a shortage of doctors across the state of Texas. Coming up, I'll let you know what some lawmakers are doing about it.
Texas is in desperate need for primary care physicians. Good afternoon. I'm Chris Willis.
I'm Sally Hernandez. But some lawmakers hope a bill designed to help doctors pay off their debts could be part of the solution. New on Austin News at noon. KXAN's Ellen McNamara joining us live near the Capitol with this story. Hi, Ellen.
Hi, Sally and Chris. Well, it's Bill 1876, and it would help those new medical grad students, well, pay off their debt if, though, they accept a job as a primary care physician in an underserved part of Texas. Now, currently, there are more than 100 counties in Texas that don't have easy access to primary care physicians. The Texas Healthcare Organizations estimate that the state is about 4,500 physicians short, which means 5.3 million people are underserved. If the bill becomes law, it would create the Texas Healthcare Access Fund and change the way smokeless tobacco is taxed. The money created by taxing all smokeless tobacco products on unit rather than price would pay off the students' debt, which averages about $160,000.
Texas faces a severe shortage in primary health care in many places across the state of Texas, and it's a situation that just keeps getting worse and worse with every year that goes by.
And Representative Chisholm says he does have support from both sides of the aisle, Republicans and also Democrats. He does not have the support, though, obviously, from tobacco companies. Now, a committee, the House committee, a House committee, I should say, will hear this bill next week. We will let you know what happens, and we'll also let you know if it gets out of committee. For now, we are live near the Capitol. Ellen McNamara, KXAN Austin News.
We've all heard stories about how the nation is experiencing a shortage of nurses, and now some Texas lawmakers say the state is dangerously short on doctors as well. KVU's Quita Culpepper is live at our Capitol Bureau with that story. Quita?
Well, Melissa, lawmakers say the number of med students going into the primary care field is down due to the amount of student loan debt they'll face, and that means many clinics are having trouble recruiting doctors. A stack of white lab coats symbolizes the 4,500 primary care physicians needed in the Lone Star State, and for many Texans, the shortage means traveling longer distances to see a doctor and longer waits to be treated in offices and inside the ER. State Representatives Warren Chisholm and Richard Raymond co-authored House Bill 1876. It creates the Texas Healthcare Access Fund, which they say will increase the number of doctors practicing in underserved areas by creating a loan repayment program specifically for these doctors. The money for the loan repayment program would come from a new tax on smokeless tobacco.
We tax all other tobacco in the state of Texas by weight until we get to smokeless tobacco, and we tax it by sales price. That's an unfair tax on some tobacco people, but it helps some of the others. So when you get to this taxing of tobacco, we ought to tax it all the same. If it's fair to tax it by weight, we ought to tax it all by weight.
Currently, there are 114 Texas counties federal officials say are experiencing a health care professional crisis. Live in the Capitol Bureau, Quita Culpepper, KVUE News.
Quita, thank you. As always, we invite you to share your thoughts on this or any story you see on KVUE. Just look for the comment section at the bottom of each story, KVUE.com.
There is a severe shortage of primary care physicians across Texas, and some state lawmakers are hoping to change that. It's estimated Texas is in need of 4,500 primary care physicians. But if House Bill 1876 becomes law, it would help medical students pay off their debts if they chose to become a primary care physician in an underserved area.
It will help providers pay off their medical costs that they incur going through this costly education, averaging $160,000 in debt.
Money for the Texas Healthcare Access Fund would be created by changing the way smokeless tobacco is taxed in Texas. Lawmakers are saying that taxing products on unit rather than price would create the money that's needed. A House committee will discuss the proposed legislation next week.
Long waits to see a doctor and packed emergency rooms. Some say a severe doctor shortage is causing big problems in parts of Texas, and not just in the rural areas. CBS 42's Alexis Patterson joins us live with more from the Capitol with details on a bill that aims to address this shortage. Alexis.
That's right, Judy. Lawmakers here are considering a bill that would give doctors more incentive to become primary care physicians by expanding the programs that help them repay their medical school loans. We're told that many doctors new to practice go into specialty care because that generally pays more than primary care practice. The result, a need for more primary care doctors in over half of all Texas counties, including parts of Travis County. This bill proposed in the Texas House would create a fund to pay off up to $160,000 in loans over 4 years, as long as those doctors serve as primary care physicians in counties facing shortages. The problem is especially critical at clinics that mainly serve uninsured and underinsured patients, since some of those clinics' administrators say they often have trouble recruiting doctors.
I like working with the population, but sometimes the salaries are a little lower, and so that sometimes distracts people from actually coming to work with the underserved. So with the loan repayment program, that also enhances your ability to actually practice comfortably.
The program would be funded through a change in the way that smokeless tobacco is taxed. If this bill passes, it would be taxed by weight. That would generate more revenue, and that tax would slightly increase in the coming years. We're live at the Capitol. Alexis Patterson, CBS 42 News in HD.
This bill is scheduled to be heard by a House committee next week. It would also provide loan repayment for other health care providers such as dentists, physician assistants, and family therapists. To read the bill, including details on the change in the smokeless tobacco tax, log on to KITV.com. Look for Alexis' story on the homepage.
Texas is in desperate need for doctors, and state lawmakers are trying to help out. If House Bill 1876 becomes law, it would help new doctors pay off their student loans if they become a primary care physician in an underserved part of our state. The bill wants to change the way smokeless tobacco is taxed to get the money needed for that. It's estimated Texas is short 4,500 physicians.